talk about all this is Dr. Chris Pernell. She's a public health physician with multiple degrees, great pedigree. So, Doctor, thanks for joining us.
Thanks for having me.
All right, Doctor, let's get right to the numbers. We, of course, are seeing sobering statistics when it comes to vaccinating our minority communities, not just in the tri-state area, but really across the country, and it may be coming at an incredible cost. Studies show that Black and Hispanic people are about 4 times more likely to be hospitalized from COVID-19 and nearly 3 times more likely to die from the virus than whites. But despite the statistics, according to a recent poll, 35% of Black Americans still say they don't plan to get the shot. And the CDC now reporting only 5% of Americans vaccinated are Black. The nationwide trend playing out here on a local level. Take New York City's latest data, for example. Black residents make up 22% of the city's population, but only 11% of vaccine recipients were Black. Whites make up a third of the city's population, and 48% of recipients were white. So those numbers really a lot to take in, but the facts are really stark. And Doctor, why do you think that we're seeing this trend?
Because systemic racism is real. So we so often we talk about systemic racism and we talk about institutional racism, but those are forces. Those are forces that impact access, right? Access to care. Those are forces that determine implicit bias. Those are forces that have determined exposure, infection, and hospitalization rates in Black and brown communities. So unfortunately, unless we have overt direct action to undo health inequities show up in every facet of our American life. So what you see is, one, there is this vaccine hesitancy, or as peers have more aptly described it, this historical awareness that Black and brown communities have. Blacks are very aware of the historical injustices that have happened to their relatives, to their loved ones, and to our community more broadly. And it's not just what's happened in the past. So it's not just the infamous Tuskegees or Henrietta Lacks or how Dr. Sims operated on enslaved Black women, but it's ongoing disparities. And a part of those ongoing disparities is a lack of access. So you want to look at what are the transportation barriers, what are the information barriers, what are the language and health literacy barriers, and what are the convenience barriers that are contributing to such low participation rates or vaccinations among Black and brown communities.